Well, welcome to a women's health panel where I am Shakira Martin here with my lovely co-host Kim Henderson. And today we are talking about all wellness things for women of color, especially in 2022. I want to start off the segments by speaking about mental health. We want to introduce Annie Montgomery, Dr. Ethiopia Jackson, and Dr. Stanley. Welcome, ladies, and how are you guys doing today?
Just great.
Good. Thanks for having us.
First off, we could start by you just introducing yourself and letting everyone know who you are.
Well, I'm Dr. Rita Stanley. I'm internal medicine trained and certified for over 30 years, the last 15 years in functional medicine, really getting to the root cause of things. Great stuff.
I'll follow. I'm Dr. Ethiopia Jackson. I'm a licensed clinical psychologist specializing in hematology, oncology, particularly with pediatric populations. And I'm happy to be here to contribute to this conversation around our psychosocial spiritual wellness.
And I'm Annie Montgomery. I'm a licensed clinical marriage and family therapist, and I am just honored to be here to share among all of these wonderful women. And I hope that I can contribute something that would be a blessing to each one of you.
Well, we thank you ladies so much for being here with us. I want to start the conversation off with what has mental health looked like, especially coming out of a pandemic in today's society for women of color. Dr. Stanley, if you wouldn't mind taking the lead.
Oh, sure. Well, you know, it just looks like an acceleration of what I have seen for years. And a lot of the mental health that I've seen over time, particularly in functional medicine, has been related to hormone imbalance. And so through this pandemic, it's just been exacerbated because there's been so much stress, and stress on our body produces other imbalances, which really manifest as just exacerbation of anxiety, depression. So that's really, in my practice, what it has looked like.
And if I may contribute to that, because I appreciate the comments that Dr. Stanley shared, I agree. And if we're talking about women of color, and especially Black women, we would be remiss if we didn't do the COVID along with the racial pandemic, because those have been intertwined. So they've exacerbated this even further, because in addition to the typical, if you could use that word, the typical or to be expected stress that any woman would be dealing with in relationship to COVID, it's a whole nother level of depth when you're talking about the racial trauma on top of that, which has actually been percolating and simmering and percolating and piking for years, okay, for centuries, if you will. And now it's just that much more off the top for us.
As a marriage and family therapist, what I have seen is that we are triune beings. And so everything that happens to us physically, mentally, emotionally, and spiritually impacts the other. And so again, I agree that COVID has added to that, as well as physical issues such as menopause and premenstrual cycles and menstruation. You know, it's just so much. And not only to mention our culture and how we were raised and what we were taught. There's so much, and a big part of it is spirituality. And I have a very strong passion for the mental health of African American women. So I'm excited to share some things with you.
Ladies, I would just kind of like to piggyback a little bit about what you were speaking about COVID, and that definitely became a barrier to any type of care I might imagine that you were trying to provide. What kind of barriers outside of COVID have you seen in your practices to mental health, whether it be Ms. Montgomery, what you were describing about people being sort of culturally, their culture putting them at maybe maybe they have a stereotype or some other reason why they don't seek help. Can you ladies just talk about how COVID affected those barriers and what barriers sort of existed before COVID or outside of COVID with regards to mental health and African American women?
Absolutely. When we think about the cultural aspect of it, we have to consider the fact that we've had to deal with poverty, with racism, with sexism, and just a number of things that contributed to the things that we went through during the COVID pandemic. And so all of those things have come into play and have affected our mental health. And when you add to that the physical piece of it, and of course, one of my strongest passion is that we be spiritually healthy, because that sets the groundwork for us to become physically, emotionally, and mentally healthy. So that's been something that I've watched, and I've worked with women in those areas.
So I'd like to expand upon that and stretch it a little bit further, because I appreciate what you're saying. For me, I'd like to shift it from mental health and mental wellness to psycho-spiritual wellness for all the reasons that you said, because people of African ancestry and pretty much many people of color, because of their indigenous practices and belief, do not separate out church and state, if you will.
Yes, ma'am.
That's something that was imposed through legal actions in the Western state of mind, but we are one of the same. So I see this as psycho-spiritual wellness, and more specifically, to add even further, barriers that we had before and now are multitude. One being that what we call mental health services, many of which are not designed for us, with the intentions of us and the issues that we're dealing with. And more specifically, when I look at my field, which is psychology, we've known forever, but they've only just admitted themselves out loud that much of their theory and work has done damage in our communities. Don't get me wrong, it's not an either or. There's been some good, yes, but in general, they have missed the mark of the complexities of what is happening for us. So an example of this would be, you can't just treat the symptoms of depression if you're not dealing with the etiology of the depression. And most times it is really this idea of what the kids call gaslighting, right? When you tell us that we're post-racial, when you tell us that we're being hyper-vigilant, too sensitive in a therapy session, there's something wrong with your cognitive thinking when I'm trying to explain to you that I'm feeling the racism at work. And my good intended clinician is thinking I'm having a distortion in my thinking. Those are some of the basic examples. And the third one, of course, would be for me, as the immediate past president of the Association of Black Psychology, and specifically as a lifelong learner around what is Black psychology, that has not been brought to the forefront in these domains where we're training our mental health providers, so they're not exposed to it. So that it's sort of like sending someone in to do surgery. We haven't given them all their tools. Okay? And that's a huge misstep. And I close by saying that when I think about our health and wellness, it is more than these things called mental health services. And I'm sure my colleagues are going to bring all this in. Much of what we do, we are each other's best medicine. We have to remind ourselves of what we need to do to take care of our psycho-spiritual wellness, from our nutrition to our habits to us just being in one another's company. This space right here is a healing modality just for us being on here in conversation together.
Exactly. Yes, yes. And I've learned, and I'm sorry to interrupt you, but I wanted to point this out before I forget. I have a tendency to lose my thought, but our culture has been so spiritually inundated in thinking, oh, all you got to do is pray and read the Bible and go to church. And so I am dealing with women, helping them to understand that it's much more than that, that you can pray, and that's a good thing. You can be in the Word, you can love the Lord with all your heart, soul, and mind, but there are responsibilities that we have to accomplish to make sure that we are healthy,
Mhm.
that we are doing well in every aspect, because we are triune beings. That's been one of my challenges as a pastor, as a preacher, and as a therapist.
Mhm.
So that's pretty hard, but I'm working on it.
Yeah, and I agree with you, Pastor, because sometimes people of faith, we don't acknowledge that we have responsibility. Basically, we have responsibilities about what we do to the temple. And I
Mhm.
always remind us that, we are the temple of the Holy Spirit. And what we put in this temple, we're putting it right in there with the Holy Spirit.
Right.
And so I think when we look at it that way, we can take ownership of our own responsibility. And yeah, you asked the question, what barriers? Access has always been a barrier, to people of color and women, even before the pandemic. And now that we're in a crisis time frame, all of those things that we came into the pandemic with, whether it's inflammation in our body or hormone imbalance or whatever the underlying problem is, it's just gotten worse. And so now we're seeing, and depression is just one example of one condition, many causes. So you
Mhm.
got depression, you got all these different causes, inflammation, hormone imbalance, prediabetes, just all these things that circle, and ultimately a bad GI tract, poor microbiome. I mean, all of those things that sometimes we as people of color don't even realize impact ultimately every aspect of our health, including our mental health. And
Yeah.
so, to me now it's like a teachable moment. Because what I find in my functional medicine practice is the people who benefit from what I do are not necessarily the people I really want to reach, because it's out of reach sometimes. Insurance doesn't cover it, but we deserve that. We deserve it maybe more than anybody to know what impact of food and sleep and all of those things has on our total health, including our mental health.
Amen.
I want to add to that. With the pandemic, I've been able myself to find a therapist and, like get to know myself a lot better. And I think the pandemic has given a lot of people the cadence to slow down and to think what's important. So my question for you ladies would be, what does it say about women of color in today's society about how we've been able to progress and wanting to start the healing process? And if there is a young lady or a woman watching us and listening to this discussion, and they're curious about where to even start, we spoke about spirituality, we spoke about going to the doctor for the psychological ways. There's a whole bunch of other holistic things to do. If someone is curious on figuring out what is this talk about, where would you say they should think or consider starting at to start the process of healing?
If I may, I'd like to tap into this. I think one of the first starting places is to remind us that women of color, and especially Black women, have been healing and thriving for centuries. Let's just start there. The problems are real, but we also don't speak to is in fact our strong resilience, our life. We are a true life force. And I would say one of the first places to start would be in your own sister friend circle, having these kinds of conversations. What's been working for others may also work for you. You may want to try something new. I appreciate you saying that you were able to identify a mental health provider, but in those cases, you have to understand who your insurance is, and because that will dictate who you're able to see. And most times when you're able to see someone, they may not be the right match for you. So you want to be clear about being a good consumer, just like how we go to the store, we can pick out just the right dress. We don't take the first dress off the rack. Do the same thing with the mental health. You should be able to say as best you can within your provider system, interview enough folks to see who feels right to you. Go with your spirit, go with your heart. who's going to help you feel, who do you feel comfortable with in that first interview type of moment will go a long way in your being able to know who to work with. And I also want to expand too to say that not only what Dr. Stanley said about reminding us about our temple, but what also comes up for me in this conversation too is reminding us that we have a right to be well. We have to say that explicitly because women of color, particularly Black women, I'm just going to say that just people just assume that's I'm talking about all, but I want to hold it. We have been socialized into glorifying our pain. The myth of the strong Black woman, we got everybody's back. We have to let that go. It takes a certain level of strength to say, I need help, sister friend.
Preach.
And not only that, the more we know, the more we're able to give to one another. Are we not giving to ourselves?
Exactly.
Exactly.
So those are just the starting points I'll say, just to summarize what my colleagues add to it. One is starting within your own sister circle, the places that have already felt safe and warm to you and what they've been doing, and so you can expand that. Two, be a good consumer, shop around for the right person for you. And if the right person is not in your insurance base, then that's going to take more work because some of us do have reduced rates for services and sometimes even pro bono. But I do ask them to reach out to the Association of Black Psychologists, as well as the Black Psychiatrists of America and the National Association of Black Social Workers websites as a couple of places to start to see if we too may be of help if they're trying to identify professionals to support them.
This may be elementary to some of you, but I have found that I have been able to grow and to do better in taking care of myself because I spent a lot of time around the older women in my life, and they were mentors to me. They taught me things that I probably never would have learned on my own without their assistance. So as mothers, sisters, aunts, cousins, whatever, friendships, grandmothers, we can learn a lot from the women who have gone before us and those who are here to still share with us. So that has been important to me. And I think we miss that because we get caught up in the intellectual, educational, medical, type issues, when we can be of very great assistance to one another just by bonding and connecting and sharing and promoting that sisterhood. So that is something that's important to me.
Okay.
About caregivers and their role with regards to our mental health and our psycho-spiritual wellness, as we have just learned about. We have with us Mrs. Lorinda Endahar and Mrs. Rhonda Custer, who are here to talk about us. If you ladies would introduce yourselves to us briefly, we'll get started.
I guess I'll go first. My name is Lorinda Andujar. I am a certified grief recovery specialist, and caregiving and mental health and grief are very personal to me. So I'm excited to be here tonight.
And I am Rhonda Custard, the caregiver coordinator for Central Plains Area Agency on Aging, and I wrap around care for caregivers and their loved ones. Thank you.
Okay. Okay. So my first question again kind of goes towards barriers and what you guys have seen that has been a source of deterrent maybe for African American women with regards to either seeking help or the ability to give help. And then on the other side of that, which is where you guys come from as caregivers, being overworked or your ability to say, you know what, I can't do this one.
I think there's a lot that goes into play when you ask those questions, because first of all, I heard it before in the panel before. We've always done it. So when you do what you've always done, you're going to get what you've always gotten. We were always taught, you take care of family, you take care of the house, you don't complain, and you leave it in the house. So that's one of the barriers that we're up against as women of colors and caregivers. And it's that sense of, it's kind of a double-edged sword. It's a sense of pride for taking care of your family, not putting them in a home or something like that. I want to be the one to oversee mom's or dad's care or my child's care. And then the guilt that comes associated with, I'm working, I'm a mom, but if I put them in a home, something may happen. Nobody's going to take care of them like I took care of them, like I can take care of them. So it's that internal fight that we create for ourselves when we want better for our family. We want to give them someone that's equipped to help them, but then we have that internal struggle. If I do and something happens, or what if I'm not there if they take their last breath? So it's that internal war with us that has us struggling as people of color when it comes to taking care of our family. We didn't have all the resources, and we know that everything medically is not equally is not fair for us when it comes to caregiving and taking care of our family. So that's my thought process on why sometimes we struggle with crossing those barriers to getting the help that we need as caregivers and taking it on as ourselves.
So I appreciate that lead in and even the lead in from the mental health panel, because one of the things that I share with our caregivers regarding barriers is that we are not super women. We don't have the cape that's flowing in the wind. We don't, and we have been set up in some perspectives for failure, because that's what happens, is that we feel like failures when we are not able to execute everything that's been dealt out to us. It takes a toll on us. We don't realize the stress, the barrier of a pandemic, the barrier of not being able to socialize with loved ones because of being in the home with the loved one you're taking care of. The stress of not being able to truly share your frustrations of what's going on for fear that someone is going to ridicule you, because your feelings are just, your feelings are valid. We have to understand that as a support system within our communities, the sisterhood, that we have to know how to impart into one another. Not all the time, the spoken language has to be verbal. We can see the toll that is taking on another individual. We know when someone is MIA, missing in action, because of taking care of their loved ones. Those barriers of feeling like they've been forgotten. We really have to get back to some normalities of yesteryear, and that's checking in on one another and making sure that even though that the word okay and I'm doing fine, and the reality is that's just air really being escaped from their bodies, when they really need to be able to exhale and know that they have a support system that's intact and ready to assist at any given moment.
I think it's awesome that we're having this conversation with you too, because even if a woman isn't choosing to be a caregiver by profession, as Black women, we have always been the caregivers, and that dates back to slavery and moving forward. So I want to ask you guys, how does one go about identifying boundaries in the midst of being a caretaker?
So I'll go ahead. Number
Yes,
one,
ma'am.
own it, own it, own it, own it. Say, I need help. Be vocal about your need. Be honest and true about what you can and can't do. The power of the no can be the power of your yes. The power of the no of not taking on more than you can control can be the very yes that you give yourself permission to breathe. And so a lot of times what we do is steady, just take on more. And I have shared with caregivers, and my heart goes out to all of my community, because of the nature of my job. When I get my people that I can assist, it gives them a leg up that somebody does care. And not only, it's intergenerational. So we've been taking care of great grandparents as well as grandchildren. We have been taking care of spouses as well as siblings. So we have to understand that we are not an island. There is support there, and it is okay to own your stuff and say, okay, I can't do it. This is my reality. Let the tears flow, because a lot of times, and I appreciate Pastor Annie being on. A lot of times the blessing comes in somebody else being able to bless you in helping. And we don't give people the permission to assist us in our needs. So yeah, we have to deal with us first and know that we're not going to be looked upon as giving up, because that's a big one. It looks like we threw in the towel, and we allow people to make us feel like that. Family can make you feel like that. Friends can make, you should be able to do this for them. How come you can't do more? All the while they're standing back with their arms folded, not offering any assistance. So yeah, I'm sorry, I'm kind of passionate about that.
No, we thank you for that.
Not at all. So I think to chime in, the challenge with knowing that you're at your breaking point is a challenge in itself. Because as women of color, we're on go at all times. So by the time that I've broken, that I'm breaking down, that I'm there, I'm already past that point. So because we carried stuff for so long, we don't know how to stop and sit down and breathe it all in. We don't know how to ask for help, because typically when we need help, there's no one around to help us. And we feel guilty for reaching out for something that we look to as our own responsibility. So being able to have a regimen of self-care is going to be important for the caregiver. Because when I was looking at this, because I've been that person that I've tried to commit suicide multiple times because the burden was just too much for me. So 20% of caregivers suffer from depression. 40% feel emotionally stressed. 20% deal with financial problems. And I want you to just think about that bucket right there. So I'm dealing with financial problems, trying to take care of somebody. It's probably the lesser evil than putting up the thousands per month to put them in a assisted care facility. So that's the lesser of the evil. So I'm less likely to let that thing go. 20% felt physically drained or physically stressed. And 3, depending on which site you looked at, 3 to 71% contemplated suicide because they were caregivers. So if you think about that, I'm not going to ask for help, because as people of color, we don't commit suicide. We don't talk about suicide. So I'm just going to carry all of that weight on myself until I finally break. And then what? Now I'm sitting in the hospital, and now I feel even worse, because now somebody has to look after the one that I'm caring for, because somebody has to care after me. So that puts a whole bunch of other stress on there. So those are some of the challenges with us as women of color, as women, period, when we talk about, crossing those barriers and not becoming enablers of our own pain, we have to have a self-care regimen. We have to seek counseling. We have to go against the norm. We have to get our spiritual community involved. We have to have an active prayer life. All of those things, people, we get so, and not to say anything because I'm a PK grandkid. My grandparents were pastors. My great-grandparents was pastors. Hey, I went to the School of Prophets, but we got to get to a place where we start telling people, you know what? You don't need to go on medication. Just pray about it. You can pray about it and take medication. You can pray about it and seek counseling. So we need to start having avenues for people to travel down when they're getting to that breaking point, and not normalizing that it's okay, you can carry it off. You got to be the superwoman. You got to do it all yourself. Like my sister said here, ask for help. But when they ask for help, have resources for them to run to, and then sustainable resources so that they don't feel like they're a burden. And that's why a lot of caregivers don't seek help, because they feel now that they're a burden because they have to place their burden on someone else.
Very well said.
And
Thank you for that.
May I chime in?
Yes,
And
ma'am.
she referenced a couple other sites regarding statistics, and 46% of caregivers die before their loved ones. Okay, so the need is great, and the understanding, some kind of way we have to get it in, the importance of not, like she said, mental health, spiritual health, the awareness of the stress that takes the toll. Even with our next section coming up, if we're not careful, we can be out of here before we even know it, and someone is left to taking care of that loved one when that was our number one priority.
Welcome back to the Women's Health Panel. We just finished a great discussion on caregiving, and now we're headed into the third segment, which is the breast cancer outreach. And today we have Bertha Harrison as well as Gail Thomas. How are you ladies doing today?
Just fine.
Doing great.
Well, we're excited to have you guys on to share with us your story. Bertha, I want to start with you. As a breast cancer survivor, what are some of the few or the first steps that took place for you to get the confidence to go and get checked out? Many women feel like, I could suffer in silence, but you have the courage to go to a doctor's appointment. Can you just share with us your story and what it took for you to have the courage to go?
Sure. I guess I've never actually been one of those type that don't wouldn't go to the doctor. I've been fortunate enough to have healthcare insurance. And so that allows you to go, like, if I get a little ping or something, I'm going to go get it checked out because I pay for the healthcare and I'm going to get it. When I turn 40, that's supposed to be the age that you begin doing your yearly mammograms. And so at 40, I began getting yearly mammograms. And so that was just an automatic thing that I was doing. However, in 2004, my mother got diagnosed with breast cancer. I mean, well, she got diagnosed really in 2002. She passed away from breast cancer in 2004. And so after that really, me and our family just, made a decision to be sure that we would go and get our mammograms yearly, maybe even more if they felt the need for that, just to stay on top of it, just because, there was a higher chance of breast cancer from within the family. And so doing a routine mammogram that I got every year, and I got a couple before that would give you, per se, I would call it a scare, but it would be like they may found a mass or found something a little different, and then they would go back and take a look at it and find out that it was nothing. So, you can go on about your way. And so in 2018, I did my yearly mammogram, and they actually called me back and said, hey, we saw something, can you come back? It really didn't scare me because I've had to come back maybe a time before and it was nothing. That's what I assumed it was. However, when I did come back, they diagnosed me with ductal carcinoma in situ. And that is the very first stage of breast cancer. You may know that breast cancer comes in stages so that the doctors and people can diagnose where you are along the process. And that will be considered like stage 0. It's a condition where they find it affects the milk ducts, in your breast, and they find that the in the milk, the lining, the cells that are in the lining of the ducts have turned malignant or cancerous, but they stay in place, so they haven't moved around or metastasized into any other area. So this is like probably the very earliest form of breast cancer, and most doctors and people in the breast cancer community really applaud you for getting your yearly mammograms and getting and noticing your breast cancer at this stage, because then it's a much better outcome. As a result of my mom passing from breast cancer a few years earlier, and I actually probably maybe I'd say maybe about 6 months prior to that, I had one of my best friends. She had been at one of her mammograms, she had been diagnosed with breast cancer. However, she had stage 3, and just going through that with her, I was making decisions in my life. I'm like, well, if I ever was diagnosed with breast cancer, what would be my choice of the journey that I would take. And so I had made a decision at that time. I was like, well, I would probably choose to have a double mastectomy because my mom died from breast cancer. There is a history of cancer in my family. Like, I have 8 or 9 aunts and uncles, and of the 8 or 9, 7 or 8 have been diagnosed with cancer, and some have died from it. So I was like, there's a real high risk of cancer in my family. If I was ever diagnosed with breast cancer, I would just do the double mastectomy, because that was just a choice that I would make for myself. I've had these breasts for a while. They are not serving, they weren't serving me anything later on, past the childbearing age and all of that kind of stuff. And then, of course, you can get new breasts, you can get some new things as a result of that. So at the time that I was diagnosed, I knew immediately that's what I wanted to do. The doctor that I chose at the time was really excited that I did make that choice, just based off of the family history that I had. So I got a double mastectomy in December, because they wanted to not that it was that aggressive, but they wanted to go ahead and attack it as soon as possible. And because I made that choice, and I think it was also the time of year, because after that part of the year, all the doctors go on vacation or whatever. And so there wouldn't have been any surgeons around to do my surgery. So I got a double mastectomy at that time. And of course, with that allowed me to be totally cancer free. However, with the double mastectomy, you have a choice of getting breast implants or getting I chose, and now I'm drawing a blank, but I chose where they do the fat transfer. So I didn't get breast implants. I have the fat transfer into my breast, and they actually transfer fat from places in your body to your breast. And they take it from it's called a deep flap surgery, where they take the fat from your stomach and place it in your breast. That was like a double up for me, because now I have a flat stomach. I got a tummy.
Yeah, perfect.
Yes.
Like, I'm getting a new body, I got new breasts, I got a flat stomach. Things are, as a result of that, things are doing better. I didn't have to have any chemo or radiation. And so I know sometimes when I tell my journey, sometimes I feel a little guilty in the fact that my journey isn't as deep or in depth as others have had, but still I have a journey. So, but it's very important to get your mammograms every year. Like I said, I never had a problem with going to the doctor or doing those kind of things, but I know some people do. Some people do based off of, medical reasons. Some people are just scared to go. Some people, financial reasons or those kind of things. But as a result of, just the regular mammograms, I was diagnosed with the in situ early enough, and I'm going on now close to 4-year survivor. 5 years is kind of the sweet point that they want you to get past prior to feeling that you're more down the stage of no longer with the cancer returning. Of course, even with the double mastectomy, the return of cancer is not ever 100% that it's like gone away, but there's a very high percentage that I won't develop breast cancer for sure. But I am a survivor and happy to be an advocate for those to go ahead and get those mammograms on a regular basis, because that helps save lives.
Thank you. Thank you so much for your story. And I just want to say, I know you said that sometimes when you tell your story, you feel like, oh, well, it's not as deep as somebody's journey. So what's the big decisions you had to make to have your breast removed? Which kind of breast am I going to get, if any breast at all? So I think if I were speaking to other women out there who have small, if we even will say, not even to say, but that all stories are important. Somebody needs to hear it. And even from the start, whatever the story was behind it, the start of getting your yearly breast exams and making those things a priority are what's important to prevent these sort of, I guess, bigger, more complicated stories. So
yeah, and they really, as a result of that too, like I've told my story a couple of times, and in church I actually told the story, and I felt, like I said, I felt the same way, because they would do the breast cancer awareness at church, and as a result of that, I did have a member from the church, and this was her second time at breast cancer, and she was making the choice to do the double mastectomy, and so for me telling my story allowed her to have a better conversation, because we had conversations and things about her making her decision to have the double mastectomy. So, hey, helping one person is definitely better than helping none. So.
Yes, and I want to follow up with that and ask Ms. Gail, when you are working with other women who are dealing with, should I go and get a mammogram? Or how should I approach this entire situation? Earlier, in one of the panels, we talked about the sisterly love and the support of a community as you're going through this. Can you just walk us through, what do you see out of Black women coming together and figuring out how to get through something as severe as breast cancer or any type of cancer to that nature?
Thank you. Bertha has a good story, a wonderful story, because one, she was getting her mammograms at 40 in the regular way and every year as she needed it. I have so many women that I run into that don't get their mammograms on a regular basis, whether they have insurance or don't have insurance. For years, I've been doing this since I started in 2005. The Women's Project of Kansas became a nonprofit in 2000. No, I started in 2005 and that became a nonprofit in 2009. I have been educating ever since. And women tend not to want to discuss that they've had either breast cancer, particularly women of color. They think it's a white woman's disease. They don't need to worry about it. Even if they've had family history, many times they still may not be women that will come in and regularly get a mammogram. So that over my years of outreach, I may run into a woman over years and take 3 or 4 years before they get a mammogram. I just keep encouraging them, trying to make sure that if there are obstacles, what are they? I used to hear for many, many years, I can't take off work. I don't have the ability to go get a women's exam and then go schedule a mammogram. That I just can't take off that way. So about 7 years ago, I started bringing a mobile mammogram to Wichita. It started out being, I think I did an afternoon. Initially, we did a Mother's Day event. And I've done 6 out of the 7 years. I didn't get to do this year. But that is one of my signature programs, a Mother's Day mammogram event. I now do Saturday at Michelle Vance at the center so that women don't have the excuse that I can't get off work, or I can do one on a Saturday, or I can do one on the evening. I try to make sure I have at least one. I'm looking to do 2 next year in the evening so that women do know they can get a mammogram. Now, for the women who don't have health insurance, we have the early detection work program. I this year was given a grant from the early detection works program to become a community breast cancer navigator. So that allows me to work on behalf of the early detection works program out in the community to enroll women directly into their program. So when I'm doing a mammogram event now, I don't have to send them to another phone number to get enrolled. So I'm hoping we're still working out getting that up and running, but I'm hoping going forward that when I'm out in the community, I have the ability right then and there to enroll a woman. We still don't get enough Black women to participate in the early detection works program, and we're still working on that. We advertise, they're not coming in. And we want to be sure that we're not missing that woman, that she doesn't start out being a stage 1, but by the time she does come in, she's a stage 4. And that's the important piece. We can't keep you from getting breast cancer if you're going to get it, but we sure want to find it when it's a stage 1 or stage 0. Your chances of survival are much greater than if we get it to stage 4. We know you have a hard road and you are metastatic at that point. So eventually you're going to pass away from breast cancer, but we don't want you taken too soon. And the only way to guarantee that, or hope to guarantee that, is to find it at stage 1.
I just wanted to say thank you so much for sharing your story. I recently was diagnosed with skin cancer and I'm 30. So to see that another young Black woman was diagnosed with some sort of cancer, it's just wild to me. But to your statement about like feeling bad when you share your story, I feel like I too kind of felt the same because I have skin cancer. I'm going through treatment now. I'm actually 6 out of 12, so we almost done. But when I sit there with the other ladies who are also going through a harsher type of treatment, I too feel guilty because I'm like, yo, I'm not, my story is nothing compared to those. But
I want to say,
at the end of
Shakira, that I needed to hear that Black folks get skin cancer. I'm over there. Well, Black folks, you know, we don't get into. And also to go a step further, I hear some of the white women at work talking about, oh, I just got my yearly look over for my skin cancer. My doctor didn't offer me no look over. That's something I need to be aware. Like, you know what? We need to start looking my skin over too.
eat clean or eat right, because you just never know what can occur. I had stage 3, and so I have to go through treatment, and all the time I'm sharing with the white person like, oh, I have melanoma, and they're like, oh, my grandma had that, or oh, my mom had that. And I'm like, but did your mom have to go through treatment? Is your mom currently in immunotherapy? No, they're not. Well, know that there's a difference between a Black person getting something that they say we're not prone to getting easily compared to a white person. So it goes back into the racial discussion that we were having earlier about things being fit for us, but also we as Black people have to come to terms and being concerned enough to ask them questions of, what is this? What is this growing on my arm? This looks gross.
And they're not checking us.
So
for it.
Michelle, I know you want to move us.
so
Can I just really one statement to that?
Okay, go ahead.
Just one. Just one. I want to acknowledge our sister circle now in the intergenerational knowledge and be curious about why are we perseverating around whose illness is worse than whose. That's that example of glorifying the suffering, as opposed to celebrating our babies, our sisters who are getting in front of this and being able to turn it around quickly. That's the shift we need to make.
So yeah, and I think as we look at that, as we look at where we're going, as we look at all of us, how do we as sister girls, how do we as women, how do we as our sisters keepers, because that's really our topic, is our sisters keeper. How do we keep each other uplifted while we are pushing through? Because I think and I don't know that you all heard the beginning. Shakira was basically kind of giving Bertha, saying, hey, don't minimize the fact that you've gone through this, because we all have some trauma. All of us have gone through some things. Dr. Stanley, let's have this discussion as we look at how we're coming through, whether it's Shakira, whether it's Bertha, whether it's Lorinda talking about caregiving. When we look at food, I know that part of your premise is that food is medicine. Let's look at that.
Well, as I listen to everybody, of course, I'm processing it through, wow, do you know what your vitamin D level is? Have you ever had it checked? Is it extremely low? Have you, what, just all these things that, and I never mean to make this simplistic, but I also know that there are some things at a very basic level that we don't even know to manage around our eating, or have measured, or demand that they measure certain things, because if it's low, it's going to increase your risk. All those kind of things I process through. And it may not change what's going on now, but what I know is that unless we have the opportunity that everybody should have to know what we should demand to be measured when we see our primary care doctor, to see if we are increased risk for certain things. Do you have inflammation in your body? You don't know. They're not measuring inflammation because we don't know to ask for it. We don't know to ask for certain things. We don't know to talk about our gut. Why are you giving me these antibiotics? If you're giving me these antibiotics, how's it going to affect my immune system in my gut? Which, if that's off, opens a door to cancer. So, I just process it. makes me want to scream, cry. But, that's why at 65, I'm still pressing so that people can learn, they'll know. And then you got a decision to make, but at least you know what to ask for. So you don't get blindsided, and you can make adjustments, and you can start taking your vitamin D supplement and just all those things. So that's kind of how I process it. Food is everything to me. Food is clean food, eating clean, hooking up. We're talking about sisters supporting one another. There's somebody in Wichita, there's somebody in Kansas City, there's somebody in Topeka who is all about, we think they're kind of strange sometimes. They're like vegan, vegetarians, they grow gardens, they juice. Listen, I tap into that like crazy now. I want to know exactly what drives you to eat like this every day. And you can see the difference in their life. I mean, you can just see it. And so I know we've got that in us just historically. I mean, we come from that. We come from people that eat from their own growth, from what they grow. So I just know that we'll never have a great chance unless we start moving in that direction. And, I can go on.
Yeah. So when we think about that, when we think about the fact that food is medicine, that most of the things that are happening in our bodies are happening in our guts and produce something else that may have an effect on our mental outlook, may have an effect on how we are looking at things. Lorinda, as you hear that, what's coming to mind? Because you immediately went, whew, I saw you raise up. So what came to mind?
Because, listening to all the ladies and to listen to the discussion, if we're talking about picking up our game as the sister circle and getting everyone involved, we have to remember two things. Comparison is the thief of joy, but education is the great equalizer. So if we can get past comparing our pain, yes, we can talk about it. Your pain is not worse than my pain. This is that. These are some of the things that I've gone through. These are the things that I learned when I went to the doctor. These are the regimens that I need to be on. Once we get past comparing our pain and putting ourselves in boxes, then we can start having the real discussion. Okay, sis, so now that we're no longer comparing our pain, we went through this. We're not going to trauma bond on this, but we're going to go towards healing. So how do we get towards healing? How do we talk about the disparities when we went to our doctor? What questions did you ask that I should be asking? What happened during this part of your life that I should be aware of? Because we're different, our bodies are different. We've been exposed to different chemicals, different backgrounds, different work habits, different stress levels. We need to talk about those things that we don't discuss as people of color and make it normal to talk about health and make it normal to talk about, I went to the bathroom, I've been having this stomach virus for this long, or, if, I want to go and have surgery, speaking to what the doctor said, food is life. If I want to go and have gastric sleeve surgery like I did, and when I find out now that I'm having all these gut issues because the portion of my stomach, I need to ask this doctor, what portion of my stomach are you cutting out? Because if you cut this third of my stomach out, you are now cutting out the portion of my stomach that produces the enzymes that break down the food. And now I have this rotting food in my stomach on top of my body not producing the acids that it needs to get this stuff flushed out of me. Now I have these toxins sitting in me, and now I'm going to get sick. Now I'm immunocompromised because I'm not getting the good bacteria, gut bacteria that used to grow. So having these conversations when someone says, I'm going to go have surgery, and not judging them because they're going to have surgery, but talk about everything that comes along with that surgery, educating them. Comparison is the thief of joy, but education is the great equalizer, is what we can do to bring ourselves together as the sister circle.
So Dr. Jackson, how do we educate ourselves?
Oh, I'm just taking all of this in first and foremost. I just want to sit in that moment. The brilliance of the circle is powerfully strong here.
I know, and it's just one of the things I'm looking at the time and I'm like, good Lord.
I know, it's just amazing. It's more than, quote, just educating ourselves. We're doing it. As you were speaking, Sister Adjua, what came up for me was sometimes we have to be good sisters by imposing ourselves, right? Not just saying, how are you? No, really, how are you? Taking time to sit and listen, because most times they need a sister friend in the healthcare system with them,
Mm.
right? To help advocate, to see me, to pose those other questions. When we've been, many of us have been, again, socialized into the doctor's always right. So I'm thinking about my own family member, and it hurts me to this day that they took her breasts without bothering to give her a prosthetic bra. And so my loved one is stuffing her breast, her bra with stockings. And this is a 50-something-year-old woman right in front of the nurse, and they're as if they're ambivalent to it. So what I'm trying to say is that we need advocates in there as well too. We're going to educate ourselves simply by talking to each other, keeping the conversations going, talking to any and everybody and learning a little bit from there. But we also must impose and shift the system, because the system doesn't see us. It's not trained to see us. It's not going to see us unless you speak up and make yourself be seen. And sometimes we can't do that by ourselves for multiple reasons. We're carrying such burdens. It's again, the breast cancer is one more on top of. So sometimes a sister needs a friend to let her put that burden down for a moment and let someone else be her voice with her, not in front of her, but with her. So that's how we begin to educate, tell each other stories, learn from them, be there for each other, share the information. Dr. Stanley saying she's right on point. Go back into the cultural wisdom within our society. Go back and what did grandma really teach us? Great grandma. We have these stories in us. We just got educated and forgot them. But now we got to resurrect them again, because they knew what they were talking about. And all of these things like mindfulness and whatnot, those were already ours. We have just forgotten them. This is things that
we
we
just
were
didn't
doing
call them that
before we came to this country. You just got to call it that.
Dr. Jackson, I am happy that you touched on that earlier when we were speaking. Rhonda spoke about boundaries and how we should say no. You bring up being mindfulness. I know that this conversation is about using our resources and getting to the point of where we're getting the help. But what do you have to say to the woman who's sitting at home? Life is chaotic and she's just trying to first be present before she can conquer what it will take to become whole. What do you have to say to those women who are wondering, how do I become mindful?
Well, first, I just want them to breathe, to take a breath before we get mindful. Just being able to sit and breathe. And sometimes this also means finding some little corner in your house or a corner in your room to make it your safe space. If it's just one, if it's the daggone closet, okay, it's your closet. Okay, how do you make it what colors make? Yes, exactly. It may be colors, it may be incense, even our dancing and moving. Again, we have these. We all know if we put a song on right now and start grooving, we're gonna feel the music. It's gonna make us happy, sad, or angry. Okay. That too is part of her remembering who she is by tapping into the music, tapping into the time when she felt most like herself, or more specifically, being able to see herself in someone else's eye. And the piece about mindfulness, I just want to get in here very quickly, because I know a number of the families I work with, particularly good, quote, Christians, do not believe in mindfulness. I want to say mindfulness was always an African way of being fully present, being connected with mind, body, and spirit. And I would submit, when I think about our family members who survived the time of enslavement, they weren't singing in those fields to entertain the master.
No.
They were singing to keep each other on their feet. If that's not a collective mindfulness, I don't know what is. If you can feel me down the road and you in this groove with me, then we are attuned with one another. We are in sync with one another. So this is our birthright. This is not something that's being gifted to us or something got to give to us. We got to beg for it. It is ours. And as soon as we go back and demand it and reclaim it, we will continue to be the force to be reckoned with and be the people we were meant to be as a collective.
Yeah.
So she just has to know that somebody loves her. Each moment, just kind of keep showing up. You can't change somebody overnight, particularly when there's been a lifelong stuff to putting in place, but never leave her alone. If you keep showing up, she will show up too. Somebody's got to love her.
You're good.
So-
Rhonda, how do we advocate? Because this is your whole space.
Okay. I so love this. When we see, okay, I had a pastor says intimacy, into me see. See me.
Okay.
When we actually see the person, that's where we pull them out. That's
Mhm.
where we advocate. That's where we say, you know what? When we talk about having each other's back, that sisterly bond, being able to go to the doctor with them and say, girl, I got you. Because I've been watching you. I see you. Therefore, I can speak with and for you so
Mhm.
that the doctor knows that those things that you wrote down that you forgot to bring, I got them because we
Mhm.
getting ready to get things checked out. You know, in this community of caregiving and advocating, it does take, you talked about where we come from. It takes the tribe, it takes the village. And every time, if that's your sister and you feel the pushback, that's actually the come in
Mhm.
because she's afraid to allow you to see those hidden tears become visible
Mhm.
because she doesn't feel worthy enough to have somebody that loves her enough to advocate on her behalf. And when you take that step, I spoke to a group at a church Sunday, and they started a caregiving group, and it was actually all white church. And
Mhm.
they talked about how to advocate. They had people there that could not make it. And I shared with them, so you know them, right? So go to them, offer to assist them with their loved ones. Because even though the word says we have not because we ask not, we are supposed to go into the hedges and byways and highways as well. So we have to go fetch them as well. We have to let them know that who they are is very important to us, that we love them enough to care about them because they're caring about somebody else. Sorry, Michelle.
No, it's I, uh um
Can we
Miss-
piggyback on Bertha with that then? Because Rhonda is talking about what it is like to be a caregiver. As someone who had to receive the help, can you just emphasize on what it felt like for your village to come around you, and for those who are going through something, perhaps they are figuring out if they want to go through it by themselves, how important it is to have that community around you?
You're
Sure.
muted.
Okay, sorry. Yeah. Um, that was very important to me at that time. Of course, like when I got my diagnosis, I have like one daughter by birth and then three stepdaughters. They are grown and live in various places. And so I was basically, me and my husband lived at home, but my husband was working on the road. And so when I went and got my diagnosis, I was alone. And that was kind of scary because, I went back and I thought, oh, it's not going to be anything, and actually they, you know, they had to take a biopsy so they could, be sure that it was actually cancer. And in the caregiver or the nurse, like a nurse, and I know the other caregiver called the name of what they call them, the nurse practitioner or nurse, whatever, I forgot what you call it. The person that nurse navigator. She was very straightforward and to the point, like, hey, this is it. This is what you got. That's it. What you going to do? You know what I'm saying? Which didn't give me enough time to kind of like pull that in and assimilate it. It was just like really rough, so it brought me to tears, of course, but, and she wasn't as sympathetic as I wanted her to be. But then I quickly went into a mode of, okay, so I know this means that I'm going to have to have surgery. There's going to be some aftercare. There's going to be things like that. I don't really have, like my daughter at the time, she lived in Atlanta, and but my stepdaughters live here, but they have full lives and children and stuff like that. And my husband, he felt like, he's like, well, I don't think his daughters, he's like, I don't think they're going to be equipped enough to be able to be there for you as a caregiver. So maybe check with your daughter and see, if she'd be interested in coming back from Atlanta to be here to be your caregiver. Of course, my daughter had no quorum. She just quit her life in Atlanta to come to be my caregiver, which worked out well. And my family, I have a big family. They came along and helped out as well. My church family did help out, but it is very important to have those people that, are alongside with you, just to help lift you up in those times, just to know that feeling that you're not alone, And I do feel bad for those people who don't have, immediate family or immediate friends that are there that are giving them genuine care, and at that point, it would be great to be able to reach out to services that do offer care, but a person that really wants to do the job to be a real caregiver and not just for the money, that would be a whole different,
Yeah.
dynamic, because you have those feelings and you can feel the sincerity in a person or not, but it's definitely important to have a tribe with you to help you along. That helps in your healing and, just getting better. It's just better for your care afterward.
Annie, you're the oldest of 9, and your mom had dementia, and your husband right now is going through some cancer treatment.
Yes.
How is that? It's one thing to be a child, having your mother, having, a parent, but it's a whole different ball game when it's your partner, and y'all have been married for quite a while.
Yes, we've been married for 48 years. My mom actually died from Alzheimer's after 10 years. And I was able to begin grieving her transition early on because I could see the progression, the transition. So that helped me a lot. I think what's been most important for me is to have a solid spiritual foundation, no matter what you're going through. But even at that, and I'm going to try not to get emotional, I have struggled. And so the village is very important. I have a large family. I have 8 siblings. They're all here in Wichita. My husband's pastored a church for 38 years. We've been in ministry for 48 years. And so all of that has been very helpful. But when it comes right down to the bottom line, I felt overwhelmed. And I didn't think that I could do it. But because of my relationship with the Lord, it has been one day at a time, and I've found myself making it. And so it's very important for us as sisters to reach out to one another. I mean, we hear the stories of what people are going through, but do we really care enough to call them, to check on them, to run an errand? I mean, those little bitty things have been so important to me. My husband is retiring in October. And this is very hard for us to do because that's all we've known. My father was a pastor for 50 years of a local church here. And so it's very difficult. I'm not going to sit here and lie to you and make you think I'm all that and I've got everything under control, because I don't. And so listening to you tonight has been a blessing to me and has encouraged me to believe that I can get through this. So I just want to thank you all for the opportunity to be online. Sorry I haven't been able to contribute as much, but this, this is my reality now.
Yeah.
It's not easy. And I understand Bertha's story because my sister had breast cancer, and we have decided that in this family, nobody fights alone. And that's a good thing. And I think that's what we should embrace as sisters.
And Sister Annie, I will tell you this, while we may not be any of these ladies on here, we may not necessarily be blood sisters by parenting. We are blood sisters by the blood of Christ. And so
Yes.
we lift you up. We lift your family. I was pleased when you agreed to be a part of this, because I knew that you fit into several categories. But we want to make sure that we lift you in our, but also, you know, we'll shoot you some words of encouragement and make sure that you're not walking alone. Amen.
Thank you.
Amen.
You know what, can I say something really quick?
Sure.
That Miss Annie said, being a grief recovery specialist, you did something, you said that you were okay, but it wasn't the okay that you said that made me know that you are actually going to be okay, that you're actually going to make it. Most people that are going through grief and trauma, they can't do emotional speak or emotional vomit. So the fact that you were able to say, I
That's right.
felt overwhelmed, that is more powerful than you will ever know, because when people are grieving and they're going through any kind of loss that is compounded one thing over another,
Yes.
if you ask them how they feel, they cannot express that. You were able to say, I felt overwhelmed. I am trying not to get emotional. You are so much further along than you will ever imagine, because you actually can verbalize what you're feeling. So do not beat yourself up and give yourself some grace.
Thank you, my sister.
Amen.
Can I jump in? I
Yep.
function as breast health outreach, but I've been a carer for 30 years. My
Yes.
son was 7 years old and paralyzed by a virus. So you can understand my life changed. And I didn't live in Wichita at the time. It was my husband and I and a child. So it was all on me because he wasn't handling it very well. Just wasn't. So I had to deal with the overwhelm that one day my child was okay. And one day, I mean, in the car, as I'm hearing an ambulance come, my child says, I don't want to die. And I knew then he was dying. At that moment, I knew he was dying. And there was nothing I could do. But an ambulance came. I had a neighbor who kind of saw all what was going on and had called 911, which was wonderful because it got him to the hospital. And yes, he survived, but he wasn't the child he was before he got ill. But we did that. I mean, he is now a college graduate, doesn't have a job, but that's okay.
Yes.
And his father died 5 weeks before he graduated from college. And I had to get him to understand that dad wouldn't want him to not succeed. And he had to get there. And we had to figure out how he was going to get there. But the whole burden, I mean, so I've been in your place, Annie. I was the caregiver to the spouse. And we get there. And I also understood the day that we weren't gonna be partners any longer on this earth, that I needed to let him go, and I was okay. God made sure I was okay.
Yes.
He made sure that my son and everybody else was gonna be okay. But I had to get my son to graduation 5 weeks later. It's like, you are going to graduate.
Right.
Let's not worry about the grades. Let's just get you done. Because it had taken him 10 years to get there. And to be a Black child in today's world, paralyzed in a wheelchair for his whole childhood and adult life, it takes stamina. And at this point, he has been in a house since COVID started because he can't come out. He can't get the vaccine. We don't know if it'll do something. And he can't get COVID because we don't know if it'll do something. So we have been, I have spent the last 2.5 years in this bubble of not knowing how can I make sure. I only see him when I know I haven't been around anybody. I haven't hugged him in 2.5 years.
Mm.
Wow.
Because I can't get that close to him.
Right.
And so when we talk about that carer, I do what I do, and I do it well. But there's that piece of me when I come home to an empty house that I have to deal with me. And sometimes I don't like me, you know, because I don't have the person who understands always what I have to, the role and the face I had to put on, because tomorrow or tonight it was a tough day.
Yeah.
So
You know,
we all do, but as a carer, I mean, I have been so blessed that
Yeah.
God gave me my child. I did not birth my child.
Mhm.
He gave me my child. And I've known from day one, it was the right child for me.
Mm.
And
thank you for
That is a
sharing that
perfect
story.
way to end. You know, there are some things that come to us. There are some things that happen in our lives that we don't always orchestrate. The plans, our plans, God laughs at our plans because they mean absolutely nothing to him. But there are things that are brought to us. There are things that we experience that only help us to grow and help us to be the people that we are called to be. It brings up those things that we never thought that we could do or never thought that we could be. And so we appreciate each and every one of your stories. We appreciate all that you have shared and contributed today. Thank you,
so
Shakira.
much.
Thank you, Kimberly, for hosting today. And
Thank you.
this
Beautiful,
has
beautiful.
been our Sisters Keepers. We are here just to keep each other
That's
in
right.
love and making sure that we are providing whatever service, whatever help we can. Because, you know, there was that old little song that says, just reach out and touch somebody's hand, make this world a better place if we can. And so that's